Hey guys, Dr. Christy Ennis. Today we are going to go over a series of mobility stretches to help ease that tension in a stiff back. If you're concerned about whether it's going to hurt, definitely check with your doctor first because obviously these aren't appropriate for everybody. But if you really just have stiffness and tightness, these usually make you feel really, I'll even add another really in there, good. They're all on your back with the exception of the last one is going to be kneeling. So you can do these in bed or you can do these on the ground. I'm going to get down right on my mat. If you like this information today, please hit that thumbs up button and that subscribe button. Arms are going to go out to the side, feet together, knees together, and I'm just going to start with a little gentle rotation. We're going to do 5 to each side, so 10 total. So here's 3, 4, 5, 6, 7, you might get a little bit more motion as you're going along. 8, 9, and 10. Now I'm going to cross one leg all the way over, and I'm going to drop my hips off to one side. So I'm stretching here into the piriformis and some of those glutes. I'm going to go the other way and get that capsule of that hip a little bit. 3, some of the other rotators of the hip too. 4, 5, try to keep those shoulder blades down. 6, 7, 8, 9, and 10. And I'm going to switch sides, obviously. We want to get both sides in there. So same idea, dropping to one side and then dropping to the other. So you should feel it, right, on that outside butt and probably more on the inside hip on that left leg. There's 2, 3, 4, 5, 6, 7, 8, 9, and 10. Good. I'm going to leave one leg bent to help protect my back a little. I'm going to bring one knee into my chest, and then I'm going to add a little bit of a knee, leg straighten. So it's going to come up and down. So there's 2, 3, 4. And after you do these, if you want to hold a little bit, you can, and 5. Same thing on the other side. Bring that knee in towards the chest. And then you're going to straighten. It's okay if you don't straighten all the way. All right, so now we're getting into that glute a little bit and into those hamstrings too. Those muscles really affect the back, so they're important to stretch them. That makes a difference in that back tightness. And here is 5. I'm going to grab both knees. You can grab underneath if that's more comfortable. Give a little bit more stretch. You can grab over the shins, never directly on the knees. And I'm just going to add a little rock side to side. So there's 2 without falling over. 3, 4, 5, 6, 7, 8, 9, 10. And then I'm going to do just a couple circles in each direction, again, without falling over. So use those abs a little bit too. So there's 2, and I'm just going to do 2 in each direction. We're getting just a little bit more mobility here, right? And there is 2 again. Whew, can't speak. All right, next one's on the side. You're going to bend both knees. This one's going to come up towards your chest, this top knee. Hold it down with the bottom arm. You can have something here to support your head if you need it. And then I'm going to rotate that arm open and come on back. You want to keep that knee down so you can always put a pillow underneath it if it doesn't want to go down all the way. The other thing is too, if it's just your shoulder that's moving, we want to get that spine mobility a little bit so you can grab onto that rib cage and pull on over, but not a bad thing to stretch the shoulder either. There's 4. We're going to get one more. I'm going to go back to using my arm because I just happen to be tight everywhere. I'm going to go on to the other side so you guys can see that. Again, we're going to go bring that top knee up. You can keep both bent. Bottom arm holding down. Arm goes up to the ceiling, and then I'm going to rotate over. Now, if I'm feeling nice and loose, my arm actually does go all the way down to the ground. Clearly, you can see that I have not done these stretches today yet. So here's 3, and I actually am already getting a little bit more open as I go. Leave your head in the center if it bothers you or creates any neck discomfort, okay? There is 5. Good. Okay, we're gonna get right up on those knees. I'm gonna bring one knee forward. You wanna think this time about activating, right? Squeeze those glutes. We're gonna stretch those hip flexors, which are a big component to back pain and stiffness. Little pelvic tuck, and just come forward a tiny bit, and then back. So squeeze, tuck, lean. Notice I'm not getting a huge motion. I'm just trying to stretch the muscle. If I go really far forward, I'm stretching the capsule, which not necessarily bad, but we're trying to get these muscles right now. There's 4, and one more is 5. Turn the other way, slide on over. If you can even have this foot directly in front of that knee to get this other little side muscle here, which attaches to the IT band, okay? That's a little balancy though, so squeeze and release. You can hold on to something if you need to. 2, 3, 4. Notice I'm not giving a big arch so that I'm not using my spine there. And 5. Yay, hopefully you're feeling much, much, much better. Thanks for tuning in and stay tuned for more.